Hi, my name is Hannah and I'll be your nurse today. Please state your name and date of birth.
Kevin O'Neill, August 2nd, 2001.
Okay, great. This is the correct patient. Today I'll be performing a focus exam on you today. It should take between 5 and 8 minutes and I'll be explaining the exam as I go along. Please feel free to stop me if you have any questions or are uncomfortable throughout the exam.
Okay.
So my patient understands the purpose of the exam, and before we begin, I'm going to ask you to empty your bladder and put on this gown with ties in the back.
Okay.
Are you comfortable in this room with respect to warmth and privacy?
Yes.
Okay, great. My patient is prepared for the exam and comfortable with her surroundings. So now I'm just going to ask you a few questions. Do you have any chronic illnesses such as diabetes, kidney failure, or high blood pressure?
No.
Are you experiencing any chest pain, shortness of breath, or palpitations?
No.
Do you have a family history of diabetes, cardiovascular disease, or high blood pressure?
No.
And are you experiencing any pain, swelling, or noticeable skin changes such as redness, warmth, or noticeable veins in your legs?
No.
Okay, great. If my patient did appear with some of these symptoms, I would assess them using Olcard's eyes and then further assess with techniques for special circumstances. So my patient is relaxed and at ease. Her breathing is quiet and unlabored, and her skin is warm, dry, pink, intact, and appropriate for her ethnicity. So now I'm going to assess your arms, and I'm just going to look at them and then gently pinch your skin. It shouldn't hurt.
Okay.
So arms are symmetrical and proportionate to her body, and skin is elastic, no tinting and noted, also no edema. And so now I'm going to take your pulses at various points in your arms. Okay. Brachial pulses are equal and strong bilaterally, and then radial pulses are also equal and strong bilaterally. And I'm also going to assess your arms and fingers and also look at your nail beds. So skin is warm, dry, pink, intact, and appropriate for ethnicity, and fingers are pink, and capillary refill is less than 3 seconds, and nail beds are 160 degrees. And now I'm also going to assess your legs, doing the same thing that I did your arms. So legs are warm, dry, pink, intact, and appropriate for ethnicity. Capillary refill is less than 3 seconds, and then the dorsalis pedis pulse is strong and equal bilaterally to plus. Sorry, that was the posterior tibialis pulse.
Okay.
And then the dorsalis pedis pulse is strong and equal bilaterally to plus. So now I'm going to assess your temporal and carotid pulses. Okay, temporal pulse is strong and equal bilaterally to plus, and then I'll assess your carotid pulses on that one. Carotid pulse is 2 plus on this side and 2 plus on this side. And now I'm going to focus on your chest, or assess your chest focusing on your heart. So chest is symmetrical and there are no abnormal pulsations. If you could just lay down for me, I will be there. Further assessment. So now I'm going to take your apical pulse for 1 minute. At the 5th intercostal space mid-clavicular line. Okay. Apical pulse is strong and regular 2 plus with 76 beats per minute. And I'm also going to listen to your chest at various points with my stethoscope. Okay, so S2 was louder than S1 at the aortic and pulmonic valve. S1 and S2 were equal at Erb's point, and S1 was louder than S2 at the tricuspid and mitral valve. And then I'm going to listen at the same points again, but with the bell of my stethoscope. Okay, there are no murmurs detected, and if you can sit up for me, I will now listen to your carotid arteries to test for bleeds. And you could just hold your breath for me while I touch you with the stethoscope. Okay, you can take a breath. I'm gonna do the same thing on this side. Okay, great. There are no bleeds noted, and is there anything else I can do for you today?
Nope.
Thank you.